So next I'm going to move on and I'm going to palpate the lymph nodes, beginning in the apex, the midline, and the lateral aspects, and the anterior posterior walls of the axilla and the supraclavicular area. I'm just going to be feeling gently of these areas. I'm noting that the lymph nodes are small, slightly movable, non-tender, and then we will move on and palpate the same lymph nodes with the patient sitting and in the supine position. Again, there's no deviation. The nodes are small, slightly movable, and non-tender. So next I'll be moving on to the female genitalia exam. Beginning just by inspecting the pubic hair. In my exam, the pubic hair is black, coarse, and curly, evenly distributed laterally and upward. So the next I'm going to move on, just inspecting the labia for symmetry, color, caking of discharge, and I'm going to palpate the labia as well. So just on inspection, you can note symmetry. Both labia are symmetrical in my exam. They are pink, full in appearance. There's no discoloration. There's no rashes. There's no visible signs of trauma. So then I'm going to move on to palpation, and on palpation, I'm going to note that there is just feeling both labia with 2 fingers, that the labia is soft. There's no tenderness on palpation. To inspect the labia minora, you should separate the labia majora with 2 fingers of one hand and palpate the labia minora with the thumb and second finger. The labia minora in my exam appears to be pink and moist. There's no rashes, excoriation, or caking of discharge on my exam. So then I will move on and inspect the urethral meatus and vaginal opening. With the labia spread open, you're going to look at the urethral meatus and vaginal opening, and there's no discharge, no lesions, no polyps or fistulas. The area appears pink and moist, which is within normal limits. So next, I will milk the Skene. I believe I'm pronouncing that correctly, the Skene glands. So first I'm just going to explain to the patient what I'm doing. I'm going to insert one gloved finger into the vagina to milk the Skene glands. I'm going to enter my index finger with the palm facing upward, and I'm going to insert it up to the second joint of the finger. I'm going to apply pressure upward and move the finger outward, and I'll do this on both sides of the urethra and directly upon the urethra, and no discharge is a normal finding, and that is what I found on my exam. And then to palpate the Bartholin glands, you will keep the labia spread open, insert a finger again, and palpate the posterior lateral portion of the labia majora. No tenderness, inflammation, masses, or heat are noted on my exam. So next I will move on and inspect and palpate the perineum. So with the finger still inserted, I'll just assess for smoothness, tenderness, fistulas, anything along those lines. And in my exam, the perineum is smooth, non-tender. There's no inflammation, no fistulas, no lesions or growths. The perineum is thick, which is a normal finding in women who have not had a vaginal birth or born children. So then next I'll move on and inspect the perineal area and anus. I'm going to note that the skin pigment is darker in this area. Just on inspection, there are no lesions, no fissures, no excoriation or inflammation noted. So next I will explain the internal genitalia exam, which will require a speculum. So again, I'm going to begin by explaining the procedure to the patient. I'm going to have the patient lay down with her legs bent. I'm going to gently insert a gloved finger inside the inner rotus and apply downward pressure, asking her to relax her muscles. Then I'm going to separate the labia minora, slowly insert the speculum. You want to go along the path of least resistance, which usually tends to be slightly downward, and you'll insert it the length of the vaginal canal. And I will sweep upwards, usually to see the cervix. Sometimes you have to adjust the speculum in order to see the cervix and get it visible to where you can make a good assessment. So when you do see the cervix, you're going to inspect it for color, position, size, and shape. So on my assessment, the cervix is a consistent pink color. The cervix is midline with a protrusion of less than 1 centimeter, which is a normal finding in a non-child-bearing woman, or not woman who is not pregnant. It's going to appear smooth and shiny. No discharge is noted. The os is small and round, which again is a normal finding for a woman who is not pregnant or had any children. So while I'm in this position with the speculum in place, you will collect any necessary specimens for culture, and you need to perform your pap smear. So you want to inspect the cervix first before collecting any cultures or performing the pap smear. With the speculum in place, you're going to insert your indicated swab, brush, or broom, rotate 360 degrees of the area you are trying to obtain the culture from, and you're going to withdraw the culturette. And then next, what you would do would inspect the vaginal walls for color, surface characteristics, and secretions. You want to do this inspect this on the withdrawal. So the vaginal walls on my exam are light pink, smooth and moist, which is a normal finding. There's no cracks, lesions, bleeding, nodules, or swelling. There are some secretions noted. They're thin and clear, and there's no odor noted on exam, and that's always important to assess while you are doing this exam. So next we'll go on to the bimanual examination, explaining again what you're doing to the patient. You want to change your gloves again, lubricate your middle and index finger, and insert the lubricated finger into the vagina. Once relaxed, you might have to tell the patient, try and relax, and then you want to insert the fingers full length of the vagina, and be careful of the placement of the thumb, because sometimes you can accidentally hit the clitoris, and that's uncomfortable for the patient. So while the fingers are inserted, you're going to palpate the vaginal walls for smoothness, tenderness, and any lesions. On my exam, the vaginal walls are smooth, non-tender. There's no lesions, no nodules, no cysts, growths, or any abnormalities. So I'm going to also palpate the cervix for size, shape, length, position, mobility. When you find the cervix, you're going to run the palmar side of the fingers along the circumference of the cervix, and the cervix should feel smooth, midline, and there should be slight mobility present of approximately 1 to 2 centimeters, which is what I've found on my exam. You're going to move on and palpate the uterus, and in order to do this, you're going to use you're going to place the palmar surface of the hand on the abdomen between the umbilicus and the symphysis pubis. Pressing the fingers upward and inward while pressing down with the hand on the abdomen and moving downward. On our exam, the uterus is midline, approximately 6 centimeters in size. It feels rounded, firm, and smooth. There's no tenderness noted, and there is slight mobility noted on my exam. So next, you're going to palpate the ovaries for size, shape, consistency, and tenderness by placing one hand on the right lower quadrant and placing the intravaginal fingers upward in the right lateral fornix. You want to press the fingers deeply inward and upward towards the abdominal hand. Sweep the fingers downward and inward obliquely towards the symphysis pubis, and repeat it on the left side, and the ovaries should feel smooth and firm, approximately 3 by 2 by 1 in size. And these can be tender on palpation, and on my exam there was some slight tenderness to my patient. Then you want to palpate the adnexal areas for masses and tenderness, and sometimes this is difficult to perform according to our text, but there are no masses or tenderness noted in the adnexal areas on my exam. So next I will move on to the recto-vaginal exam. So again, explaining to the patient what I'm doing, changing my gloves. Then I'm going to lubricate my fingers, and I'm going to place an index finger into the vagina, and you want to ask your patient to relax, and then place the middle finger into the rectum. And you want to assess the sphincter tone, and on this patient there's tight sphincter tone, which can possibly be out of fear, but it's not abnormally tight, it's within normal limits. So then, while the fingers are still in the rectum, you're going to palpate the rectovaginal septum. You want to slide the fingers in as far as they will go and ask her to bear down. The rectovaginal septum on my exam is thick, smooth, non-tender, tight in tone. There's no nodules or irregularities noted. So then I want to palpate the posterior aspect of the uterus and the anterior posterior rectal wall for masses, polyps, or any irregularities. And on my exam there's no masses, no polyps, nodules, strictures. There's no tenderness or irregularities on exam. So when I'm removing my fingers, you're going to note any stool or blood on the fingers. You're going to just make a note of the color of the stool. If there's any bright red blood noted, the color, is it dark and tarry, is it clay colored? These are all indicators of a lot of different things. So next I'll move on to the male genitalia exam, and we're going to begin again by just doing some inspection, looking at the pubic hair. The pubic hair is thick, black, coarse, curly, and even distribution, which is a normal finding. Then if the man is uncircumcised, you'll retract the foreskin, but on my exam the patient is circumcised. I note an apparent dorsal vein. The glands are erythematous and dry. No smegma is present. The external meatus is small, pink, looks like a slit on the ventral surface, with no urethral drainage. So next I'm just going to palpate the penis for tenderness or induration, and you're going to palpate with the thumb and index finger, run it along the shaft, and there should be no tenderness or induration noted, and on my exam there is none. Next you will just inspect the scrotum and the ventral surface of the penis. There is darker pigmentation noted on my exam on the scrotum, which is a normal finding. The left testicle appears slightly larger than the right, so it is not symmetrical, but on an exam of the scrotum that is a normal finding. On palpation, the texture is rough. There's no abnormal thickening. There's no hernia noted. So next you will transilluminate the scrotum You'll use the pen light and put it against the scrotum. You perform this normally if you felt any mass